What contraindications are there for carrying out myofascial release?
Okay, so a big one for me with professional performers is sunburn. So singers who are out, I mean, it seems really basic, but singers, performers, actors who are out in London enjoying the sun, enjoying a cheeky bevy on, by the Thames, and what happens is they get sunburn, and then when I put my hands on them, it hurts.
Big contraindication.
Big contraindication. And with the performers image-based, performers are image-based as much as they are, talent-based, and as much as they are ability-based, they are image-based entities. And so, if they need a tan, or they don't need a tan, or when they come into the clinic, I can't touch them.
It's a big one. Yeah. To me, the question is too broad to fit in all the different possibilities we can have here, and there definitely have to be sound clinical judgment, clinical reasoning when it comes to diagnoses, both post-surgical, post-radiation, etc. Again, I don't act as a first line of defense with somebody, for instance, with a new voice disorder. I'm going to send them back to their primary to go get seen by an ENT and be scoped and really evaluated to make sure that medically there's nothing in there that we shouldn't be intervening with.
Yeah.
Right? To me, we've got contraindications and concerns that we pay attention to. To me, the two most important things are, can the person feel that I'm doing something? And can they communicate to me that they're feeling something? Meaning, they might have radiation fibrosis that alters their sensation, but can they feel maybe not the full extent of touch as they would have won before the radiation, but can they sense that I'm doing something so they can be a participant in the therapeutic dialogue, right? And can they communicate with me? Now, I work pediatrics early intervention in the first part of my physical therapy career, and you're talking about a small baby, and they're pre-verbal. They can't tell you the nuances of what they're feeling, but they certainly can tell you if they don't like something.
Yeah.
Right? And that's one of the first things I look for, and why I want nonverbal communication so much with my patients is because I want to know that you're feeling something, and hopefully you can communicate to me that it's somehow relevant. And those tend not to hit the list of people's contraindications and concerns, but they're two of my greatest concerns.